mynews.studio.
Picture this: 415 million people moving out of poverty in just 15 years. How did India manage to make change on that scale?
That number almost feels abstract, doesn't it? For context, today's date is 2025-07-14. If we rewind 15 years, over half of India's population was living in what's known as multidimensional poverty. That covers more than just income. It includes a lack of access to education, healthcare, and basic needs. In 2011-12, 16.2% of people in India, so around 206 million, were surviving on less than $2.15 a day. The worst affected states were places like Uttar Pradesh, Bihar, and Madhya Pradesh, especially in rural areas.
Exactly, and poverty at that time wasn't simply about low income. It also meant not having a secure home, enough food, or access to schools and clinics. What's interesting is that India didn't just make small changes, they rethought their approach completely. So what did they actually do differently?
They introduced several large-scale initiatives. The public distribution system, for instance, provided subsidized food, essential for many families. Direct cash transfers helped ensure money reached those who really needed it, skipping intermediaries. And then there's MGNREGA, the Rural Employment Guarantee Scheme, which made paid work available in villages during tough times.
Plus, there was major investment in health and education. Ayushman Bharat pushed towards universal health coverage. The Right to Education Act meant that every child had a right to schooling, not just those who could afford it. Also, they focused on supporting women and young people, skills training, microfinance, self-help groups. That changed who could participate in the workforce, didn't it?
Yes, it did. These weren't just relief programs. They aimed to build people's capacity. The idea was to give individuals the tools to move out of poverty on their own. But there's another important factor: data. India adopted what's called the Modified Mixed Recall Period, or MMRP, for its surveys. Can I pause you for a second? Why is that survey method so important?
Great point. The MMRP improved accuracy. Instead of asking people to remember everything they spent over a long period, surveys matched the recall period to the type of item, shorter for food and regular purchases, longer for things like appliances. This adjustment led to higher reported consumption and more precise poverty estimates. So, the progress reflected real changes, not just a shift in statistics.
And the results are striking. Extreme poverty dropped from 16.2% to just 2.3% between 2011-12 and 2022-23. That's a fall from 206 million to only 34 million people. With a higher threshold, $3.65 a day, poverty fell from over 60% to 28%. That means 378 million people crossed that line.
Multi-dimensional poverty, so including health, education, and living standards, dropped from over half the population to 15.5%. The rural-urban poverty gap narrowed a lot, and even the Gini index, which measures inequality, went down. That suggests growth became more balanced.
But did these policies have the same impact everywhere? For example, were some programs more successful in rural areas than in cities?
The strategy was actually quite tailored. In rural areas, the focus was on essentials: food, healthcare, education. The Pradhan Mantri Garib Kalyan Anna Yojana delivered free food grains to over 800 million people. Employment schemes improved livelihoods. Financial inclusion, like the Jan Dhan Yojana, helped millions open bank accounts so they could receive benefits directly. In urban areas, the focus shifted to skills, entrepreneurship, and housing. Schemes like Stand Up India and PM Vishwakarma Yojana targeted marginalized groups and artisans. The result? Rural poverty dropped from 18.4% to 2.8%, urban poverty from 10.7% to 1.1%. The gap between rural and urban poverty nearly disappeared.
So, adjusting for local needs really mattered. But looking ahead, Can this progress last? What about economic shocks or changes in global poverty lines?
Partnerships played a big role. NGOs and international groups helped scale programs and keep them accountable. The private sector contributed digital infrastructure, Aadhaar, the National Digital ID, for instance, and new financial services. These partnerships helped benefits reach even remote places. But there are ongoing challenges: keeping funding steady, dealing with inflation, and making sure people don't slip back into poverty if the economy changes. There are still gaps, especially in health, education, and jobs for marginalized groups.
Quick technical check. The shift to MMRP in data collection, how much did it actually affect the reported progress?
It was significant. By matching recall periods to people's actual spending habits, the estimates became much more accurate. For example, with the old method, poverty in 2011 to 12 was reported at 22.9%. Using MMRP, it was 16.2% for that year, and then 2.3% by 2022-23. So the change isn't just on paper, it aligns with what's seen locally. But it does mean we have to be careful comparing old and new data.
So, India's experience shows that broad strategies like social safety nets, economic reforms, and investing in people can make a real dent in poverty, even in countries with huge populations.
It demonstrates that large-scale poverty reduction is possible. Combining welfare, growth, and inclusion has created a model that's now under study around the world.
And the process isn't over. India still has hurdles, but the past 15 years show what can happen when policy, data, and partnerships work together.
Today, we traced how 415 million people in India escaped multidimensional poverty thanks to targeted programs, investments in health and education, and improved data. The world is watching. Will other countries try this approach?
Thanks for joining us as we explored the facts behind one of the largest poverty reduction efforts ever.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.